whatever you eat today, try to avoid the same things for the next 4 days.
I always say that I'm a doctor and a student because I've always believed that a doctor is a doctor only till the day he consider himself a student. And today's session, I think again, is proof to the same that of course learning together and raising awareness is an integral part of what we do.
When you say allergies, what are the type of allergies?
That allergies and intolerances are completely different. Is that when we talk about allergies, these are an IgE mediated reaction. IgE is basically a kind of antibody.
What is inflammation cascade? I mean, this is something that is being lot discussed right now. And what does it lead to if it is untreated in the long run?
So, Neeraj, when we speak about any broad groups of diseases, now these can be neurodegenerative diseases like Alzheimer's or Parkinson's. These can be various mood disorders like anxiety and depression. These can be cardiovascular diseases that can lead to increase in certain inflammatory biomarkers like your HSCRPs and your interleukins, etc.
Hi, good evening. Welcome to our show. We have Dr. Arjun Dang himself here today, CEO and partner Dr. Dang's Lab. So we are going to learn so many things from you today, sir. First of all, I would like to request you to please briefly let us know about yourself, please.
Thank you, Neeraj. It's indeed a pleasure and a privilege being here. And just as a brief introduction, I am a doctor and trained in pathology, and my specialization is in GI and liver pathology. Also, I am a certified clinical allergist by YACI. YACI is the European Academy of Allergies and Clinical Immunology. And of course, whenever I introduce myself, instead of just introducing myself as a doctor, I always say that I'm a doctor and a student because I've always believed that a doctor is a doctor only till the day he consider himself a student. And today's session, I think again, is proof to the same that of course learning together and raising awareness is an integral part of what we do. And interactions such as today, I always look forward to because there's always more and more for us to learn every day.
What a wonderful thought. When you say allergies, so our viewers would like to know what are the common allergies, what are the type of allergies. So if you can briefly give us a background on this, please.
Of course, I'm glad you're asking me this question to start the conversation, and that would set up the appropriate preamble to this discussion that we are having. Because I feel that there are so many people today who come in for testing and for advice and go to doctors just by the plain simple thought that they have a food allergy. Now, firstly, it's very, very crucial to understand for everyone that allergies and intolerances are completely different.
Oh, I
Now,
see.
again, breaking it down for people to understand this very simply is that when we talk about allergies, these are an IgE mediated reaction. IgE is basically a kind of antibody that your body produces when it is exposed to certain allergens. These allergens can either be food allergens or these can be respiratory allergens. Respiratory allergens are nothing but allergens that are found in the air around you and also known as aeroallergens. Now, what happens is that when a person is exposed to any of these allergens, there is an immediate reaction.
Oh,
How I usually teach my team is by telling them that immediate means IgE. So
oh,
always remember that an immediate reaction that happens within a few minutes by food or respiratory allergens is a true or a classical allergy.
okay.
Food allergens, again, commonly can cause immediate diarrhea, vomiting. They can also cause any kind of skin rashes, hives, urticaria, swelling on your face, or even they can cause various other symptoms that can lead to a life threatening reaction that we call as anaphylaxis. And in a lot of cases, that starts with a choking sensation in your throat as well.
Okay.
Again, the respiratory or the aeroallergens we see more commonly in cases such as asthma. That is one of the most common forms of respiratory allergies. Also, apart from this, sneezing, wheezing, coughing, allergic rhinitis that basically happens when you have a runny nose or repeated sneezing, also watering eyes and itching eyes. All of these are symptoms of respiratory allergies. So, in one nutshell, all of these are IgE, that is the
Okay.
immediate reaction to various allergens, and these are put in the bucket of classic allergies. Now, coming to the other side of the same topic is the IgG based reactions.
Okay.
So, IgG again is a delayed reaction. Like I told you, that the IgE, that is the immediate reaction, happens within a few minutes.
Right.
IgG is more delayed in nature. Again, a simple way of remembering this is how we refer to our Dada Ji and Nana Ji. So,
G.
it's more delayed, it takes time to happen. Now, this can of course take from starting from about 2 to 3 hours to even 2 to 3 days for
Oh.
the person to have symptoms. And broadly, the school of thought behind this is that certain food items that, when ingested, have a pro-inflammatory reaction. Now, how do we measure this inflammatory reaction? Is by actually measuring the IgG antibody. Similarly, like how in allergies we had the IgE antibody,
Right.
in this we have the IgG antibody.
Okay.
Now, a major part of IgG, there are four subclasses, out of which three subclasses are considered to be pro inflammatory. And if there are some foods that we are eating and have a higher IgG level in your body, they are considered as creating more inflammation.
Right.
And hence, of course, to avoid them or eliminate them for a certain period of time, to enable your gut lining to start healing, is something that is widely believed. And science and scientists both are more and more considering that food intolerance, by the means of measuring IgG, is a very scientific way to help your gut heal and restore itself. So, broadly, IgE, that's immediate, IgG, that is delayed, IgE leading to all the symptoms that I described, IgG more leading to symptoms that are associated with chronic inflammation. Now, chronic inflammation can either be only focused on the gut, so it can be bloating, gastritis, gastroesophageal reflux, IBS, constipation, or it can also be any chronic inflammatory disorder where I won't say that food intolerance perhaps is the main cause, but it's certainly the fuel on the fire.
Oh.
Now, what I mean by that is that if there's any kind of chronic inflammatory disease, like even metabolic syndrome, for example, or if there is any autoimmune disorder such as Hashimoto's thyroiditis, or even in cases of uncontrolled diabetes, or even in cases of rheumatoid arthritis, migraines, I mean, there's a wide plethora of these autoimmune disorders where increased inflammation in your gut can activate a vicious cycle that can lead to that autoimmune disorder flaring up more. So I'll take a pause here, but broadly, I'd like viewers to remember the difference between classic allergies and food intolerances.
That's very well explained. In fact, I would like to ask one question. You mentioned about the gut lining. So, if you can just educate the users, the viewers, on the gut lining, please.
Of course. So, even in medical school, we were always taught that the gut is the place where your food enters and then it gets digested and
Right.
then further it is excreted out through your
Right.
stool. Of course, the alimentary canal is a very complex structure having various functions. But over time, what scientists now call the gut is not just a simple organ, but a sophisticated surveillance system
Oh.
of any human. Now, what they actually mean by that is that about 60% of your immune system lies in your gut. A human in their average lifespan eats about 25 tons of food. Now, this 25 tons of food, Neeraj, includes various bacteria, viruses, parasites, chemicals, and a lot of things that the gut has to assess, assemble, and then digest.
Right.
Now, when we look at all these foods, of course, these foods also come with their own challenges for the gut to digest.
Right.
Now, to make it very simple for the audience listening in as well, it's important to understand that this surveillance system, again, of course, is not foolproof.
Okay.
There are certain foods that might be pro inflammatory. There might be a pizza, perhaps, that both of us share with the exact same ingredients, but you might be reacting to the tomato and the cheese, whereas I might be reacting to the olives and the gluten in the base of the pizza. So, of course, inflammation is something that is not one size fits all.
Okay.
It's more personalized to an individual. And
Understood.
of course, the lining of the gut is something that is very important for us to consider when we talk about inflammation in the gut,
Right.
because an integral part of increased inflammation in the gut is how this lining gets thinned out and hence causes a certain chemical cascade to happen due to the leakiness of the gut that increases. Again, to put it very simply and for our viewers to understand, just consider a bag in which you're constantly putting in things, but at one point of time, some of these things start corroding the surface of the bag. So it
Correct.
starts oozing out a
Right.
few of these materials and causing various kind of chemicals also to ooze out and causing that inflammation that of course is of paramount importance when we look at the baseline inflammation in any individual.
Really, this is very insightful. Our viewers would also like to know how is autoimmune conditions related to IgG delayed food allergy or let's say food intolerances.
Of course. So, Neeraj, I read this somewhere that your genes load the gun, but your lifestyle actually pulls the trigger.
Wow.
So, I mean, genes, unfortunately or fortunately, cannot be changed in a person,
Yes.
but how we live our lifestyle. And when we talk about lifestyle, again, your diet and your exercise, I think, are two broad pillars, apart from, of course, sleep and stress and other things that do control a large amount of the inflammation that we host in our body. Now, from a perspective of diet, that again is a crucial component of that. I do feel that the inflammation that we are talking about and that forms the base for any autoimmune disorder is controlled directly by the foods that we ingest.
Okay.
Now, a lot of people might point a finger at this and say that, but autoimmune disorders have a completely different etiology.
Right.
So I'm in complete agreement with them. Autoimmune diseases can have a wide variety of causes.
Right.
But I mean, at the end of the day, someone who has a chronic illness will, of course, look at finding a cure in their own kitchen. Because
Absolutely.
the most common thing that they're actually ingesting on a daily basis comes from their kitchen, and
Absolutely.
hence looking at the foods from a perspective of seeing the foods that are going to exacerbate their condition more, and then of course follow an elimination and then a stabilization phase and then a provocation phase and follow the guidelines of an IgG based food intolerance test, I think is something that is very helpful. And also we've seen in cases where patients do follow this, they do show a direct correlation in improvement of their symptoms as their gut health is restored and it improves. So I mean, there is tremendous amount of literature as well where various kind of autoimmune disorders have led to drastic reduction in symptoms that is directly proportional to the gut inflammation, and how gut inflammation again hand in hand is more proportional to the IgG footprint of the food items that are being reduced.
The information that you shared is very insightful. I mean, this will go a long way in educating the people and the public in general about how to overcome critical health challenges. So, I'm very curious to know. In fact, some of the viewers also wrote to me that please would you like to focus more on a leaky gut? I mean, we would like to know more on the leaky gut part. What is leaky gut actually? Why does it happen?
Of course. So, leaky gut again is a topic that's been widely studied in the recent past and more in the West and the US and the various countries in Europe. And A lot of scientists have started using these terms interchangeably when we talk about leaky gut or we talk about increased gut permeability. Now, of course, it's the same phenomenon that I just explained, but basically, it's due to derangement in certain biomarkers
Oh,
that are found in your stool and also in your blood. These biomarkers, most commonly, these are called as zonulin antibodies or the zonulin protein itself. Also, basically, for you to understand, zonulin is nothing but the protein that holds together the junctions in the membrane of your gut mucosa. Apart from zonulin, also we have this biomarker called occludin, and then we have LPS, and also Candida IgA and IgG till a certain extent can be a good indicator of
okay.
increased gut permeability. And of course, leaky gut and gut permeability, I always feel can be the cause and the result of a food sensitivity.
Okay.
Now, if you have gut permeability, it's going to lead to more food intolerances. And if you have increased gut permeability, foods can also cause it. So it's like a chicken and egg story where
Okay.
you have to pull out those foods so that the increased leaky gut can be started to undergo that repair and restoration cycle. And of course, leaky gut again can lead to a wide plethora of these reactions that we were just speaking about.
Okay. So it means even children can have leaky gut?
Absolutely, absolutely. So, a great example of that is how I see a lot of pediatricians and functional doctors also use the IgG food sensitivity or the food intolerance test very widely in children who are ASD, that is have autism spectrum disorder.
Okay.
And of course, I mean. There is a lot of literature around the gut brain axis, and in autism again the key driving factor of any kind of increased disease presentation is again increased inflammation. Also, if you see, a lot of ASD children also present with either decreased gut motility or bloating or gastritis. And of course, for the treating physician also to understand which are those triggers that are increasing inflammation in their gut is extremely critical. Along with this, they also test for certain heavy metals that I
Okay.
see regularly, because at the end of the day, ASD being a more chronic disorder, they have to remove these triggers from the child's life on a day-to-day basis. And hence this particular test has shown wonders with a lot of children who have ASD.
So, Dr. Jitang, I would also like to ask you, in fact, I would like to also throw some light on this myself, that after this test is done, let's say this is IgG food intolerance test that we are talking about today. So, once this test is done, what are your views on overcoming the challenges? How does the protocol follows? And what are the compliances that need to be done after the test is done?
So, Neeraj, I would say that one of the most common questions
Yeah,
and apprehensions rather that
right,
patients have
right,
when they are going for this particular test is that I don't want my child, or for myself also, I don't want a long list of foods
right.
that I'm forbidden to eat, and I am a
Absolutely.
foodie.
Right.
And what about my cheat days? And what about me going on vacations and enjoying the foods that I enjoy the most?
Absolutely.
I mean, it is important for today's discussion to dispel those myths around the fact that your choices to eating those particular foods are going to be limited drastically. So I think our viewers today deserve to understand that what is that actual path that they follow once the report is ready. So would request you to throw some light on that.
Yes, in fact, I have been into this counseling sessions for this patients. In fact, a lot of children also, adults also, women also, who have been suffering from long. And when they come with their IgG report, it's like something very mysterious to them. This is something I have been eating all along in my life, and suddenly I cannot eat it. I am not able to understand why. And the second thing is what I'm going to eat. Am I going to remain hungry? So this is the other way around. Why it is the other way around? It's because now you exactly know what is causing you a problem. So in fact, anything that causes a problem has to be eliminated. That's the first rule of any game of recovery. So once you eliminate those foods, yes, you cannot remain hungry, because this is not a dieting plan, it is change of a diet. Whereas nature has blessed us with hundred of food items which we may not be aware of. You see, we are very busy in life. It's the same paneer we cook every day, or you can say the same roti we are eating every day. So it's like a monotonous diet that we are eating. Whereas yes, this reports that are there and the foods that are there and the nature that has blessed us with wonderful varieties is where we help them understand, okay, if you can't eat this, yes, there are 10 alternatives which are available. Let me take a case of wheat. We see that a lot of people who do IgG test, they are intolerant to wheat. I mean, this is something very common. We have seen milk is there, eggs are there, so many things are there. So they have so many questions. Oh, I'm eating roti every day. Now, in Indian population in India, especially North India, you see roti is a very common grain that we eat. So yes, roti still can be eaten, but avoid wheat flour. So then, alternatively, what you can have millet flour, you can have quinoa flour, you can have almond flour, you can have tapioca flour. I mean, you can have rice flour. I mean, nature has given you so many options. It's only you need to do a little homework. You need to discover, and you need to bring them into the kitchen. Yes, I agree. It's not a one night's job. It takes time to settle down. But yes, when it settles down, it gives you fantastic results in the sense, first of all, you are eliminating the challenge foods. You are bringing down the inflammatory conditions in your body. So your body starts to heal. You feel high on energy. Your symptomatic condition starts to fade away, and your sleep pattern becomes better. You become energetic and you become enthusiastic. Now, as a result, what happens? You start to eat healthy. When you start to eat healthy, then there is another protocol that we tell you to follow. It's called a 4 day rotation. It's a beautiful concept. It's a scientific concept of 4 day rotation. What is 4 day rotation? Whatever you eat today, try to avoid the same things for the next 4 days. It means, let's suppose if I'm not intolerant to apple. Now, if I tell you, if you eat apple today, avoid apple for the next 4 days. You may ask me what I'm going to eat tomorrow. Tomorrow, eat some other fruits. I mean, guava, banana, so many things are there. Nature has blessed us with at least 8 varieties of fruits and vegetables in any season that you see. So, technically, for a human being to get enough nutrient, they should be eating 2 fruits and 2 vegetables every day. Now, coming back to the question, why 4 day rotation? So, the first scientific reason is, to the foods you're not intolerant to today, there is no guarantee that it will not become intolerant tomorrow. But if I ask you to rotate, the chances of developing intolerances to those foods are minimized to a very large extent. The second scientific reason, if I ask you to rotate, you'll bring varieties in your diet. So your monotonous diet will go away. So what will happen if you bring varieties? Our body needs various nutrient, micronutrient to perform more than 10,000 functions in the body every day. So let's take an example. Magnesium itself is responsible for performing more than 300 functions in the body every day. Technically or typically, let's say in a hypothetical case, if I'm eating a diet where there is no magnesium, what will happen? Those 300 functions will be disrupted. So the body's performance will go down. There might be some slowdown in the processes that is happening in the body, and over a period of time later in the stages, I might experience some symptomatic conditions. Now, when I ask you to rotate, you will bring varieties. So each food has got different nutrient. Some has got vitamin C, some has got vitamin K, some has got magnesium, some has got calcium, some has got iron. So your body's nutritional needs are taken care of by eating varieties. Also by, let's say, superfoods, avocado, quinoa, so many superfoods nature has blessed us. Now all these are very easily available. Thanks to this availability, now people have become aware. People are developing new choices, new taste. So then it is a boon for us, I should say. The third scientific reason why you should rotate. What is the significance of rotation? We never know how the crop has been produced and brought to our kitchen. Even if it is organic, it still might have environmental toxicity. See, our body has got the capacity to tolerate those toxins, but to a certain limit. So if I keep eating something which is having, let's say, toxicity, pesticides, chemicals on a daily basis, it might harm my gut in a long run. So if I ask you to rotate, that means the toxins will go in less amount in the body, because all foods are not toxins. Let me give you one example. Let's suppose papaya. In a common life, common people, everybody, we eat papaya, but papaya is wrapped in newspaper. It could be contaminated with metal toxicity. It could be, or maybe, we never know. So let's suppose we take another example of apple. Apple is coated with wax. Even if it is organic, we never know. But we cannot stop eating apple and papaya. We have to eat them. The only thing is we can just be little aware of this, mindful of it. Okay, let's rotate. Let's not eat it every day. So that's my take on 4-day rotation.
Very well explained, Neeraj. And I always also feel that when a person comes in with any of these broad symptoms, and again, IBS being very common in that age group, I see post 50 these days. I also feel that people usually jump to getting a food intolerance test done. So we also get this question that is doing this test the key to that lock that's going to unlock all our issues in related to our gut health and our health. So I want to be very genuine and very frank to our viewers
Right.
on this particular show. And like I explained earlier, no, it is not that magic key to that lock. But I would rather say that it is an integral part of the journey that you take to improving your gut and overall health. Now, this is something that you can make a difference your 3 or 4 times in the day when you're having your various meals. But of course, never forget that any kind of a person who has these various gut related disorders or any of these chronic inflammatory conditions, it's crucial for them to, of course, see a gastroenterologist and then, of course, rule out any kind of organic or infectious
Oh,
disorders that they might be suffering with. For
right,
example, I see chronic H. pylori infections, or
right.
a lot of people suffering from SIBO, that is small intestinal bacterial overgrowth, or a wide variety of other issues. Chronic gastritis, again, I mean, that requires an endoscopy. I mean, in certain cases like IBD, inflammatory bowel disease, people do require a colonoscopy or a calprotectin test, or in certain cases, they need a fecal elastase to be done. So, I mean, let's not forget that the doctor's role
Yes,
and
absolutely.
especially a physician's role is critical
Critical.
in order to diagnose the condition and then help monitor it. But of course, from the comfort of your home, if you can do something with confidence,
Yes.
that is to identify the culprit foods and then, of course, follow the guidelines on how to reduce the overall inflammation in the gut with tests such as the ImmuPro test.
I agree with you. I mean, this is one of the key intervention, but not the only intervention. Of course, there is a medical, consultation that is required, medical path that is required. But yes, if you can reduce the inflammatory markers, it can actually be a very good, helpful guide in overcoming those challenges in a long run. So, one question I would like to ask you, which our viewers have always been asking, what is inflammation cascade? I mean, this is something that is being lot discussed right now. And what does it lead to if it is untreated in the long run?
So, Neeraj, when we speak about any broad groups of diseases, now these can be neurodegenerative diseases like Alzheimer's or Parkinson's. These can be various mood disorders like anxiety and depression. These can be cardiovascular diseases that can lead to increase in certain inflammatory biomarkers like your HSCRPs and your interleukins, etc. All of these, even chronic inflammatory skin conditions
Oh,
like eczema, psoriasis, all of these have that underlying increased baseline inflammation in the body.
Okay.
Now, of course, there are various biomarkers that help us gauge the various levels of inflammation. But then again, these inflammatory biomarkers currently are very non specific. For example, an HSCRP value can also increase if someone has just sprained their ankle. It can also increase if someone has a mild throat infection or a strep throat, like we call it. So, I mean, these are very non specific in nature, but overall, in the long run, when this inflammation is more chronic and it persists for a longer time,
Right.
is when this chemical cascade of inflammation, for our viewers to understand, it's just falling dominoes. And that is very difficult to control unless you actually make that very sincere effort from a lifestyle perspective of actually changing things, because without realizing it, years can pass and this inflammation can increase, and the condition of your health can worsen over time. So, that is certainly something that we should be mindful of.
So you mean to say it's like a silent activity that is happening in the body? I read somewhere in the Time magazine, they have in our Time magazine cover that they say inflammation is like a silent killer. So it means it remains silent, it brewing inside the body, and it suddenly blast off one fine day without giving any notification. Is it correct?
So, there's so much debate and talk about anti aging modalities, right?
Yeah,
And I always believe that when we talk about slowing aging,
right,
again, if you just focus on your diet, exercise, sleep, and stress,
right.
I mean, to optimize sleep, to reduce stress, and of course, improve your diet and enhance your exercise. I mean, no matter what else you do in life,
Right,
but if you follow these four pillars
right,
of longevity,
right,
I mean, you reduce inflammation
right.
and you improve how your overall health is.
Absolutely, very correct. I mean, this is something that our viewers must be, uh, they must get knowledge about this. That what is inflammation, how to overcome inflammation. So, what are the inflammation markers, and how do we know that there is an inflammation in my body? How can I check for that?
So, traditionally, we've had a few inflammation markers that are considered as markers of systemic inflammation. Like I said, these are non specific in nature. So, they can increase in case of a sprained ankle or a bruised knee, to a back pain, to an infection, to any kind of inflammation in your gut. But it's very difficult with these to pinpoint what is the exact cause of
Cause.
inflammation, although there are cardiac inflammation markers
Okay.
and there are different organ specific markers that are in development. So of course these are things like ESR, that is very traditional and very non-specific. Then you have your C-reactive protein,
Right.
a more sensitive form of C-reactive protein and known as HSCRP, that is high sensitivity C-reactive protein, that is also known as a cardiac inflammatory marker.
Right.
Again, a very interesting other cardiac inflammatory marker is LPPLA2. This is known as plaque and looks at the instability of the various plaques in your arteries, and is also considered an independent risk marker for stroke and for any kind of cardiac events in the future. Also, apart from this, we have various interleukins like IL-6. Like you would remember during the deadly COVID pandemic,
Right.
IL-6
Yes.
was always asked as a marker along with ferritin, and
Right.
both these were seen to go up in any of these inflammatory conditions.
Right.
Also, again, an emerging biomarker is something that we call as TNF alpha, that
Right.
is tumor necrosis factor. So,
Right.
all in all, these various inflammatory markers, it's always helpful to get a baseline value and then see how their value is progressing over a period of time, with the efforts that people make with their lifestyle and various interventions that they undergo.
Great. So one more question that's coming to my mind is, let's suppose there is a very healthy human being. He doesn't has any injury. So that in but still he has got a high level of inflammation. He did a C-reactive protein test and the inflammation markers were very, very high. So what does the role of a change in a diet play in bringing down those inflammatory conditions?
So again, Neeraj, I'll repeat again, but an elevated inflammatory marker deserves a thorough consult with their physicians,
Right.
who has to do a head-to-toe examination.
Understood.
And of course, in certain cases like high sensitivity CRP, if it's elevated, they will of course look at certain other cardiac biomarkers as well, and perhaps some imaging too, to rule out any kind of inflammation
Right.
in the heart itself.
Right.
But overall, like I said, a piece of the puzzle,
Yeah.
especially, is the diet that they are
Right.
having, and to identify the pro inflammatory foods, and then, of course, eliminate or reduce their intake.
Okay, then they should go for an IgG mediated food intolerance test.
Yes, that's a part of
That's a part
integral
of the.
part of the process for them
Okay.
to understand and
Okay.
calibrate that inflammation.
So it was a very wonderful session today. We discussed so many scientific information, and all thanks to you and to your experience. I mean, the viewers will definitely be more aware in general. I had this one last question in my mind before we, you know, so when you say that, okay, after doing a food intolerance test, I mean, the body starts to heal and the inflammation condition starts to go down, how much time typically does it takes for the body to show the results?
So very interesting question, and also that is a FAQ by persons undergoing the test. So what I feel anecdotally is that there are broadly two parts to the results that are clinically visible, and also what the person or the patient feels themselves. I feel there is one acute phase and then there is one chronic phase. So
Okay.
I would say the acute phase would be within the first 42 to 48 to 96 hours, within the first 2 to 4 days, where they feel lesser bloating, and they also feel an immediate kind of drop in weight of a few hundred grams. And that is basically because after eliminating the inflammatory foods, there is less water retention,
Right.
and of course the gut gets like a sigh of relief from those extremely elevated or inflammatory foods. So I think that is the first part of it, and that is also in certain people very motivating from a certain perspective.
Right.
And then, of course, the second is the more chronic phase,
Right.
where after discontinuing that particular food and as their gut starts to heal,
Right.
I mean, I think that phase comes after many weeks or a few months. So
Okay.
we start seeing that perhaps in 2 to 3 months, and that would be about 8 to 12 weeks. Of course, that can vary, but it also depends on how much of an IgG level that particular food has. And of course, how strictly are they following that elimination phase, especially for certain foods that need to be avoided for about 5 to 8 weeks. So I think it depends on various factors. But again, there's an initial phase and there is more of a long term kind of result that we see, especially in more chronic and autoimmune disorders.
Great. So let's suppose if I want to do an IgG test, or the viewers themselves, anybody would like to do an IgG test, how should they get in touch with you? Is this test available at Dr. Dank's lab?
Of course, so Neeraj, what really excites us and keeps us up at night is novel tests
Right.
in the IVD segment. Now, these novel tests are key focus area in the past few years. Of course, apart from many others, has also been gut health.
Right.
So, apart from testing for gut permeability and certain gut permeability markers that we call as the gut barrier panel,
Right.
we that also includes a zonulin and a cludin and LPS and Candida. We are also offering certain other gut health tests, such as testing for SIBO. We also have a breath test for H. pylori. We also have various other tests that, of course, help one understand and get to the root cause of their own gut health. Also, apart from this, we offer a wide variety of allergy and intolerance testing. Of
Right.
course, ImmuPro is the main test that we offer for IgG based intolerances. Whereas for allergies, again, in the wide plethora of tests, I think one test that deserves a mention here is the Allergenius DX. This is an AI powered component allergy test that looks at 160 plus allergens. And of course, like I explained, it deals more with the IgE related
Right.
reactions. And this is a one of its kind molecular test that not only looks at the whole allergens but also at different components inside those particular allergens. And I mean, these are just few of the tests that I have mentioned, but we are blessed to have a wide plethora of tests that can help one evaluate their gut health. So of course, this is a very simple test. This is a simple blood test. The entire process for the sample collection takes only a few minutes. And of course, we have home collection available not only in Delhi but across the country as well. So any individual who wants to get this test done just has to contact us via any of the channels that are available online or through calling us. And of course, our teams can help them get the test done. And of course, along with the test, because we always believe that it's integral for the person to understand the report and then, of course, leverage the findings in that report in their day to day basis, we also offer complementary counseling so that the person can understand the report better.
Wonderful.
Also, for our viewers to understand, we are firm believers in hand holding the patient, and it's not a transactional counseling. It's actually over a period of time. Like if someone gets a test done today, and maybe a couple of months from today they have some other queries about the
Right.
diet that they can
Right.
have, or they just want to discuss their clinical condition, of course our counseling team is also available for that follow up. And of course, you and your team deserve all the credit for that bit.
Thank you, Dr. Arjun Dang. It was really very, very insightful, and I'm sure that today our viewers have got much more enlightenment on the good health and the gut health and the inflammation, and also on IgG, IgE, and various other markers and the tests that are available at your lab, at Dr. Dang's lab. And also the best part of it, that what you told is about hand holding and the guidance. So I agree with you. It's not only about giving your blood and money, but to ensure that they could get a better health also. Thank you today for joining, and I look forward to joining you again. Maybe in future, maybe we'll wait for the viewers to ask more questions from us, and then we'll come back to you. Thank you, and have a wonderful journey towards healing the patients always.
Thank you, Neeraj.
Thank
Thank
you.
you for having me. Thank
Pleasure,
you.
sir. It's a pleasure. Thank you. Good evening.